Start record. We continue our lecture about the heart failure. We speak in first part about the general concept in management, and we speak about the role of diuretics, role of beta blockers, and we start the inotropics drugs. The main one, which is glycosides or digoxin. And we speak about the digoxin side effect and its effect. And now we will speak about the contraindication and precaution of using the drug. Whenever there is a ventricular arrhythmia or dysrhythmia, this drug can lead to more arrhythmia. So if the patient has arrhythmia other than atrial fibrillation, atrial flutters, AV blocker عنده أو any type of arrhythmia, so we don't use the drugs. So the contraindication, ventricular arrhythmia and heart blocks. This is the most important point in contraindication. The other point is electrolyte imbalance. And this is very important. زي ما قلنا, this drug is associated with toxicity and has a narrow therapeutic index. We said we have a factor that increase the toxicity. And even with the therapeutic dose, the patient may develop the toxicity. This electrolyte imbalance is important factor. So if the patient has a hypokalemia or hypomagnesemia or hypercalcemia, it will increase the risk for the digoxin toxicity. So before we use the drug, we have to do a baseline investigation to check the electrolyte, especially this electrolyte. Two, if they are decrease اللي هم magnesium and potassium, hypokalemia and hypomagnesemia, and hypercalcemia, we have to correct this electrolyte before starting the drug. The drug is excreted by the kidney, so if there is a renal failure, we should adjust the dose or don't use the drug. And we have to don't use the drug with other drugs that decrease the heart rate because it decreases the heart rate. This is the main precaution you have to know. Then how we can give the drug, the dose and the administration route. For now, you just need to know we can give the drug by two ways. One of them known as slow digitalization. As we said, the drug known as digitalis. So slow digitalization. And we have which is known as a rapid digitalization. And when we need طبعا a high dose in a short time, so we have to give the drug by a rapid digitalization IV with a higher dose. If we need يعني slow digitalization or cumulative method, so we don't need urgently to increase the concentration of the drug, so we give the drug orally and with a small dose within longer time, which is known as slow digitalization. That's what you need to know for now about the dosage and administration of the drug. The adverse effect of the drug can cause headache, weakness, and seizures زي ما قلنا. The pharmacological effect, the most important one, which is the signs of the toxicity, we can suggest the patient has a toxicity if the patient develop anorexia, nausea, or vomiting or visual change, especially the yellow vision. The patient see a yellow halo around object, بيشوف حاجات دايرية كده وصفراء and palpitation. The patient may develop a tachyarrhythmia or bradyarrhythmia. طيب, if we suggest the patient who has يعني we have أول حاجة to advise the patient who using oral drug at home. If the patient develops these symptoms, this is the serious symptoms, the patient has to come to the hospital. Then at hospital, we have to confirm the diagnosis and to do a baseline investigation. Confirm the diagnosis.
Doctor?
Yes.
I'm sorry, but all of them are excreted by the kidney, right? All what we
All,
have to the drugs.
all of the drug excreted by the kidney.
So they're the
No,
contraindicate. We can't
no,
use it when
no,
we have.
no. No, we
Yeah.
have a drug which is excreted by the kidney. We have a drug which is excreted by the liver. We have the drug which is
Yes.
excreted by both and by other system. The drugs which is completely excreted by the kidney and had a narrow therapeutic index, it will be a contraindicated if there is a renal failure.
Oh, all right, all right. Now it makes sense. Yes, thank you.
تمام؟ يلا. طيب. زي ما قلنا to confirm the diagnosis we have to do ECG, taking a good history, do ACG and do investigation for the electrolyte imbalance. طيب please close mute yourself الفاتحة طيب who is speaking mute Sarah طيب uh, then we have to treat the patient. Firstly, we have to stop طبعا the digoxin use and we have to do a baseline. قلنا we have three electrolyte can lead to digoxin toxicity, hypokalemia, hypomagnesemia, and hypercalcemia. If there is one of them, we have to correct the electrolyte. If there is arrhythmia, we have to treat the arrhythmia, depend on type of arrhythmia. If tachyarrhythmia, we have three drugs, lignocaine, phenytoin, and beta blockers. And if it is bradyarrhythmia, we can use atropine for the patient. Then if the patient is not responding or the patient is severely ill, we can give a direct antidote for the digoxin. We have antibody which is directly bind to the digoxin, inactivates the digoxin and excreted with the digoxin by the kidney. So increase the excretion of the digoxin. This is known as Fab fragment or Fab antibodies, which is antidote for dioxin. We can give the patient this antibody. So this is the treatment. The question, how could you suggest the digitalis toxicity and how you could manage the patient?
By stopping it.
Yes, firstly, we start by stopping it. Like you have to know all the step of
Sure.
treatment, not just stop the drug. تمام؟
All right. Yes.
طيب. Because this is the drug زي ما قلنا used in chronic heart failure. In acute heart failure, we have inotropic drugs, which is highly and rapidly effective drugs. We have dopamine and dobutamine, and we have which is known as phosphodiesterase inhibitors and myelinated. Dopamine and dobutamine is affecting beta 1 receptors. It's agonist for beta 1 receptor, so it can increase the heart rate, increase the contractility, and give a positive inotropic effect. And this drug could be a vasoconstrictor. Dopamine is affecting many receptors. Depend on those, it affecting the receptor. Low dose affecting D1, which is called a vasodilator, known as inodilator, and intermediate dose affecting more receptor with D affecting B1 and B2. So the drug could be used in intermediate dose in cardiogenic shock and in patients with acute heart failure, and with a high dose affecting more receptors like alpha 1 and D2 receptors. So we can use dobutamine, which is highly selective for the heart, and if the patient has a concomitant disease, any other shock, we can use the dopamine. The uses in cardiogenic shock and in other shocks like the neurogenic and septic shock. طبعا they activated the sympathetic nervous system So they can give the symptoms of sympathetic nervous system, which is arrhythmia, tachyarrhythmia, increase the angina or aggravate the angina, and can cause a hypertension for the patient. The second, which is commonly used drug, is phosphodiesterase inhibitors, milrinone. And if you remember when we discussed the nitrates and we said we don't use the nitrates with sildenafil, the Viagra, we said the Viagra can stop enzyme known as a phosphodiesterase enzyme. This enzyme breaks down the cyclic AMP and cyclic GMP. So it will increase the amount of cyclic GMP and EMP, the AMP. This drug is working by the same mechanism, mainly in heart muscle. The cyclic AMP, if it increases in blood vessels, it can cause a vasodilation, relaxation of all smooth muscle. But if it increases in heart muscle, it causes the opposite. It causes a forced contraction. So this drug can cause a forced contraction inotropic effect, positive inotropic effect by increasing the cyclic AMP. The effect in blood vessels will be a vasodilation, relaxation of smooth muscle. So this is the mechanism of action of this drug. The drug is known, mildly known. It can cause a vasodilation and can cause a positive inotropic effect. The major adverse effect of the drug is a hypotension. The drug is associated with a hypotension due to vasodilation, and it could be used in cardiogenic shock in acute heart failure patient. Depend on patient, like if a patient who is hemodynamically unstable, because this is the main drug will be discussed. All other drugs are discussed before, so just we mention them. So in vasodilator, we use this is a vasodilator. We commonly use in heart failure the ACE inhibitors and angiotensin receptor blockers because this drug, besides they are a vasodilator, they stop the RAS system. When the RAS system can aggravate it and increase the progression of the heart failure. So the most commonly used drugs are captopril and losartan as ACE inhibitors and angiotensin converting enzyme. طبعا قلنا الفوسفودايستريز inhibitors المايليرينون also can cause a vasodilation, and we have hydrolazine and nitroprusside. Both these drugs could be used as alternative, and they found they are decrease the mortality in patients with a heart failure if we can't use the ACE inhibitors or angiotensin receptor blocker. This is the effect of the drug on veins. Preload reduction means the drug affecting the veins, وبالتالي مثلا النيتريتس and nitroprusside affecting mainly the veins. And this is the effect on the arteries. So for example, the hydrolazine mainly affecting the arteries. We don't need to know these details. Just we have to know the ACE inhibitors and ARB, the most commonly used drug. طبعا ال ACE inhibitors وال ARBs is discussed before. The last drug discussed today is known as atrial natriuretic peptide, and this peptide or this hormone is secreted from the right atrium. When there is a congestion of heart due to heart failure and the heart is full of blood, so the atrium will extend it and start to release a hormone known as AMP or sometimes بيسموه BMP. And this hormone is a vasodilator and increase the renal perfusion. So this hormone will increase the diuresis, which is decrease the preload and relieve the heart, also cause a vasodilation, which is facilitate or helping in pumping of the blood without resistance, and venodilation, which is also decrease the preload. We take the same recombinant drug، يعني أخذنا recombinant drug from this hormone, and we give this drug for a patient who is in a severe case. We give the drug as known as nisratides in acute decompensated heart failure, when as alternative third or fourth line when other drug is not used. We have a drug which is not written here لكن هو combination between ARB and a drug which is also increase the atrial natriuretic peptide لكن by prevent its breakdown. The drugs known as ARNI, ARNI, which is commonly used here in heart failure, which is relieves the symptoms combination. Two drugs relieve the symptoms and decrease the progression of the.
Doctor, I have a question, if you may.
Yes.
Doctor, what is the first line for the chronic heart disease and the first line for the acute heart disease? Heart failure, I'm sorry.
Very good question to understand the concept. Let us to complete the acute heart failure, and I will give you a conclusion for treatment of heart failure. Then we complete the lecture. تمام?
Okay, doctor. Yes, تمام.
The treatment of cardiogenic acute pulmonary edema. This in patient who develop acute heart failure. For example, a patient develop a myocardial infarction for the left ventricle and then develop acute heart failure. The blood will fill the heart and the heart will be full of blood. The blood which is coming back from the body, from the lung, will find the heart full of blood, so back for the lung, which is lead to lung congestion, then pulmonary edema. How we can manage this patient? It depends on patient, and it depends on the يعني aggression of the acute heart failure. If the patient is hemodynamically stable, we use which is known as LMNOP، يعني من ال L لحد ال P. L for loop diuretics. We use the diuretics to decrease the fluids in the body, and we have to modify the medication. طبعا قلنا likely the patient بيكون on chronic heart failure and using a medication. We have to adjust the medication. The patient may stop some medication, increase or taking a high dose from some medication, so we have to modify the medication. M for nitrate, which is a vasodilator and help the heart to pump the blood, and we give the patient oxygen لأنه we try to give more oxygenation for the tissue, and we put the patient in cardiac bed, which is known as يعني position known as a cardiac bed اللي هو 45 degree to relieve the lungs. لما البيشنت يكون في 45 degree is better than to be flat. The fluids will fill all the lungs loops. لكن when the patient in a 45 degree, some of the upper part of the lung will be free of the fluids, and then the exchange of oxygen will be better. So this is how we manage acute heart failure if the patient is hemodynamically stable. If the patient is become unstable, so we have to give more drugs. Likely, we give the patient inotropic drugs and vasodilator to helping the patient. Here in hemodynamically also, if the patient is not respond, we can give a vasodilator and the drugs which is can helping the heart. زي ما قلنا, if it is hemodynamically unstable, we have to give a drugs which is treat or increase the inotropic effect اللي هو phosphodiesterase inhibitors, the myelin and dopamine and dobutamine. That is all about the heart failure and management of the heart failure. how to manage the patient with a heart failure. Heart failure is a chronic disease. The main problem, the heart failure is progress disease. وبالتالي the patient is continuing progress from uh, A level up to D level and advanced heart failure within time. Mainly this is mainly due to sympathetic activation and rush system. So in our treatment of chronic heart failure, we try to relieve the symptoms if there is a symptoms and prevent the progression of the heart failure. The drug which is used to prevent the progression and decrease the mortality and morbidity of heart failure is beta blockers, ACE inhibitors, and ARBs SGLT inhibitors اللي هو قلنا it discovered for diabetes and we found it decreased the mortality in heart failure and aldosterone antagonist which is also stop the RAS system. The aldosterone antagonist known as mineralocorticoid receptor blockers or yes. This is the drug that decreases the mortality in heart failure. We have a drug which is used to relieve the symptoms. Whenever there is a symptoms and depend on response of the patient, we increase the dose and we adding a new drug. The drug which is used to relieve the symptoms is diuretics, loop diuretics mainly, and we can add thiazide in some cases, and digoxin for the patient who are not responding for this drug or a patient with a specific other disease like atrial fibrillation and atrial flutter. So we have other drugs used in heart failure, like this is the most commonly used drug and what you need to know. If the patient has acute or chronic heart failure, we use LMNOP uh, for treatment, and then we can add inotropic drugs other than the digoxin, and we can use vasodilator depend on patient needs. That is all, and thank you. Any question?
Thank you, doctor, so much. So we have
Thank
two types: the one who to reduce the mortality, and one for relieving the symptoms, right?
Yes.
So we have a mixture of some of mortality, decreasing mortality is for chronic, and some is for acute, right?
Yes. So
Okay.
the drugs that decrease the mortality is not affecting the symptoms, or it could affecting mildly the symptoms. It can decrease the symptoms,
Okay.
like in is mainly used to prevent the progression whatever the effect on symptoms. So if we give this drug and the symptoms is not relieved, we can use a drug which is used for a symptoms, mainly the diuretics drugs. Whatever the patient is on acute heart failure or on chronic heart failure.
Chronic. And I'm sorry, just a last question. Atrial natriuretic peptide, you will use it only in severe cases. If the
Yes,
first drug we couldn't, yani, couldn't help.
yes, is a third or fourth line for treatment for the patient who are refractory to other disease, to other drugs.
Okay. Thank you so much دكتور والله ما
Thank
قصرت دكتور.
you, thank you. الله يديكم العافية إن شاء الله وموفقين كلكم. إن